Today, we're diving deep into a truly terrifying condition, acute respiratory distress syndrome, or ARDS. And we're going to do it by following the incredible, harrowing story of a 2-year-old boy. His fight for every single breath will show us exactly what this disease is, how it attacks the body, and just how ferocious the battle to survive it can be.
You know, the scariest stories often have the most ordinary beginnings, and this one is no different. It starts the way a million other childhood sicknesses do, with a fever and a cough. It's that familiar scene every parent knows, something that seems routine, something you think you can handle.
But this time, something was very, very wrong. Look at this timeline. Just 12 hours in, his parents are already in the ER, but he gets sent home. Day 2, they see the pediatrician. Twice, they leave with an inhaler. By day 3, everything has spiraled out of control. He's back in the ER, and this time, he's critically unstable. So you have to ask, how did it all go so wrong, so fast? Well, this number tells you everything. His oxygen saturation was only 74%. Now, to put that in perspective, a healthy person should be 95% or higher. 74% isn't just low, it's a catastrophic failure. His body was literally being starved of oxygen because his lungs had stopped doing their one essential job. And when they took a chest x-ray, they saw why. The image was shocking. A healthy lung on an x-ray looks dark, right? Because it's full of air. His lung, it was almost completely white. Doctors have a name for this, pulmón blanco, a white lung. It means the lung is so swamped with fluid and inflammation that it's essentially solid. This was no simple infection. This was a full-scale invasion.
And with that, the medical team finally had a name for the enemy they were facing. ARDS, Acute Respiratory Distress Syndrome. So let's break down what that diagnosis really means.
Okay, so that's a lot of medical jargon. Let's translate. ARDS is basically when the lungs get so inflamed that fluid floods the tiny air sacs, and the patient essentially starts drowning from the inside. And, this is key, it has nothing to do with heart failure. The real hallmark is something called refractory hypoxemia. That's a fancy way of saying you can blast a patient with 100% pure oxygen and their oxygen levels still won't come up. The lungs have just given up. They've lost the ability to get oxygen into the blood.
Now for kids, diagnosing ARDS isn't just a hunch. Doctors use a very specific checklist, the PALIC 2 criteria. It's a systematic way to confirm the illness hit fast, that the imaging shows that telltale lung damage, and, super important, that it's not a heart problem causing the fluid buildup. For this poor 2-year-old boy, he tragically ticked every single box. So now we know the what, but to really grasp the battle that was unfolding, we need to zoom in. We need to go microscopic to see what an ARDS attack actually does to the lungs. So what in the world is happening inside the body to cause this kind of total system failure? This isn't just about a little fluid. It is a full-blown, catastrophic, inflammatory war.
It's a devastating chain reaction. First, the incredibly delicate barrier between the air sacs and the blood vessels gets damaged. That's the floodgate. Fluid just pours in. Then, the body's own immune system goes into panic mode. It sends a flood of inflammatory cells to the rescue, but instead of helping, they just add to the chaos. This whole mess destroys something called surfactant. Think of it as the non-stick coating for your air sacs, keeping them from collapsing. Without it, the lungs become stiff, heavy, and concrete-like. Breathing becomes this monumental physical effort, and eventually the transfer of oxygen, it just stops.
With that firestorm raging inside his lungs, the medical team had to move, and they had to move fast. It became a desperate, escalating race against time, trying one intervention after another as he continued to slip away. You can just feel the tension rising as you look at this list. First, they tried high-flow oxygen. It did nothing. His levels stayed in the 60s. Next up, a BiPAP machine, a mask that forces pressurized air into the lungs. Still no improvement, so they had to take the next big step, intubation. A breathing tube down his throat, letting a machine breathe for him entirely. But even on the ventilator, even after they added a special gas called nitric oxide to try and help, his oxygen levels cratered to a shocking 45%. They were out of tricks. There was only one last extreme option left.
And that option is called ECMO. It sounds like science fiction. You have to think of it as a complete, artificial lung that lives outside the body. The machine pulls all the blood out, adds the oxygen, removes the carbon dioxide, it literally does the lung's job for them, and then pumps the blood back in. It is incredibly risky, but it buys time. It gives the body's own lungs a chance to rest, and everyone hopes to heal.
And it worked.
After everything else had failed, shortly after he was put on ECMO, his oxygen saturation finally, slowly climbed back to 90%. It was the first real sign of hope in days. The machine was working. The tide was just beginning to turn.
But just surviving that initial onslaught is only half the battle. Now the long, slow, and incredibly fragile journey of recovery had to begin.
And this timeline just shows you what a marathon it was. He was on that artificial lung machine for 11 days. It took 20 days, nearly 3 weeks, before he was strong enough to breathe on his own again. And it was a full month before he was even stable enough to leave the ICU. Every single one of those days was a hard-fought victory.
And his victory? Well, it's put into incredibly stark perspective by this number. Even with all of our amazing modern medicine, the mortality rate for pediatric ARDS is a staggering 20 to 35%. He survived a condition that, at a minimum, 1 out of every 5 children does not.
And really, the odds were stacked against him. He didn't just have ARDS, he had the most severe form, and it was complicated by sepsis. That's a body-wide infection. For any child in this situation, delays in treatment or other organs starting to fail can make the odds even worse. His survival is just an absolute testament to the incredible, rapid-fire care that he received.
And that right there brings us to the single most important takeaway from this whole story. ARDS in kids is not just a smaller version of what happens to adults. It's a completely different beast. A child's immune system, the mechanics of their lungs, it's all different. And that's exactly why having these specialized pediatric guidelines and treatments is so absolutely critical. Understanding that distinction saves lives.
And so, all of this leaves us with one final, big question. This little boy's journey started with a simple cough, and it ended with a month-long battle for his life on the most advanced technology we have. As our understanding grows, the real challenge is this: how do we get better at shielding our kids from these sudden, overwhelming attacks before they even begin?